AIDAVA is a trustworthy AI-powered virtual assistant prototype. Researchers financed by the European Commission have been working on this project, which brought together partners from 9 European countries. The prototype was tested in 4 hospitals in 3 European countries by more than 80 patients. This virtual assistant is using artificial intelligence technologies to clean and harmonize heterogeneous health data from diverse sources. Data coming directly from the hospital and non-hospital data, such as GP data, medical devices data, and patient-reported outcomes. The virtual assistant then delivers a high-quality, interoperable digital twin of a patient's personal health records in the form of a personal health knowledge graph. From the personal health knowledge graph, we automatically generate 3 outputs. The patient health summary, the IPS, in an EHRXF format, compliant with the European Health Data Space Regulation, demonstrating that AIDAVA can automatically generate any critical category of data in compliance with this regulation. The patient's cardiovascular smart risk score, demonstrating the potential of AIDAVA to generate, automatically rather than manually, any output of value for clinical care providers. Data elements of a breast cancer registry in an OMOP-like format, demonstrating that AIDAVA can support secondary data users by publishing across hospitals' data elements in the same format. To understand how we can automate curation, quality enhancement, and publishing, please listen to how we configure the system through onboarding the data sources to enable automated curation. Onboarding data sources is a 3-step process in the system. First, the hospital needs to provide a detailed description of each data source in a data transfer specification, the DTS. This includes, for each data element, the data type, a label, and a textual description of the content. The DTS also includes metadata about the data source, including provenance information such as author, dates, and other details. Obtaining this information can be time-consuming when legacy systems have knowledge gaps, a lack of qualified staff, limited vendor availability or readiness, and so on. The second step consists of mapping each data element to enable automatic curation. Structured data are mapped to the AIDAVA ontology. Unstructured data are mapped to a curation workflow that invokes different AI and non-AI tools. Mapping data elements to the ontology requires specialized skills that are not commonly available. In addition, it is prone to human interpretation, with differences that lead to non-interoperability. In AIDAVA, we are exploring AI-based mapping tools to decrease the complexity of this task. The final step is to store this information in the data source catalog. This source catalog is, de facto, an extension of the EHDS data description. The whole onboarding process could be seriously facilitated with the enforcement of the EHDS mandated data description, with the right level of details. This data source onboarding process needs to be performed once per organization. It can then be applied to each patient record. A sister video, available on our website, shows how the system works, including several use cases with a focus on data sources and different users. If you want more details, visit our website and let's get in contact.